So now I'll invite the next speaker, Dr. Ankeeta THALI, and her paper won a JS Mahashabde Award in community ophthalmology, and she's going to talk on teleconsultation ophthalmology reaching every nook and corner.
Thank you, sir.
Yeah.
I'm here to present my paper, Teleconsultation, Ophthalmology Reaching Every Nook and Corner. I do not have any financial interests. So teleconsultation refers to the use of technology to deliver healthcare remotely, and as we all know, ophthalmology is a technologically forward field. The first project of teleophthalmology was published in 1975, and of course it left a major impact during the COVID-19 pandemic. The aim of our study was to analyze the impact of teleconsultation in India's rural community. Coming to subjects and methods. So first, let us talk about the teleconsultation unit, which we refer to as vision centers, which are set up in the rural communities, each one catering to a population of about 20,000 to 50,000 people, and each one equipped with equipments for slit lamp and fundus photograph machines, Sheards tonometer, trial sets, retinoscopes, optometrists, and a good network for communication. Besides this, there are also sphygmomanometers, glucometers, electronic medical records, and an optical shop. So the optometrist basically takes the history, does the refraction, and takes the slit lamp and the fundus photographs. Coming to the base hospital setup, so there is an exclusive room which has 2 computers with good network for communication, and at a time it is handled by 2 qualified ophthalmologists and 2 staff nurses. Then teleconsultation is carried out with the help of 2 apps, namely Skype and Remedio. So the doctor can communicate with the patient using the Skype app via video call, and the images which are sent by the optometrist are viewed by the doctor using the Remedio app. So a systematic retrospective analysis was conducted over a period of 18 months from April 2022 to September 2023 on data which was obtained from 41 such vision centers of 10 of our hospitals spread across 9 states in India, and this is a map showing all of our vision centers except for those in Coimbatore, because those alone were 17. So the data included the number of patients that were examined, treated, and referred to the base hospital, the demographic profile of these patients, the conditions that were being treated, and also the number of patients that underwent cataract surgery. So what we found that we had examined a total of 1,91,194 patients with an average of 10,366 per month, and most of the patients were seen at Coimbatore, about 44.78%, again owing to the maximum number of vision centers. We found that most of our patients were females, and most of them were more than 60 years of age, and majority of the patients had visual acuity ranging from 660 to 3/60. The most common presenting symptom was diminution of vision, and the most common diagnosis that we found were lens-related pathologies, but again, most of the patients had more than one symptom and more than one diagnosis. So coming to the discussion, Bone et al. in 2020 found that with a population of 1,380 million people, India had 270 million people living with vision loss, out of which 9.2 million were blind. In developed countries, the average ophthalmologist to population ratio is around 39 per million, while in India it is only about 15 per million. What makes it worse is within the country itself, in urban areas, there is 1 ophthalmologist for 10,000 people, while in rural areas, there is 1 for only 250,000 people. Therefore, teleconsultation can help us bridge this gap. In our study, we found that most of the patients were females, most of them were more than 60 years of age, and those with severe visual impairment. And there have been studies in the past with similar findings. It could be due to the inability of these patients to travel long distances to the hospitals. So we found that 33.6% of the patients had lens-related conditions, out of which 19.75% of the patients had cataract and were advised surgery. 23,623 patients were found to be below poverty line and underwent cataract surgery completely free of cost. 65,425 patients were prescribed medications via teleconsultation and were found to have resolution of symptoms. And almost 31,000 patients were found to have refractive error and were prescribed spectacles. By all of this, it is very clear that teleconsultation can help to reduce the burden on the healthcare system. Besides this, it can also help in early diagnosis, referral, and treatment of posterior segment pathologies, as well as in early diagnosis and treatment and referral for glaucoma. And again, there have been studies in the past that prove that teleconsultation can indeed help in this. But we have to also think about the limitations. So the most important one being cost effectiveness. Obviously, the initial cost of setup of these teleconsultation units is quite a lot. There are some areas, especially in these very remote areas, that have poor network for communication. And also there are certain conditions that are difficult to diagnose with just teleconsultation alone. But despite all of these limitations, we cannot forget the benefits. It is beneficial to both the ophthalmologists and the patients, and it aids also in KSB's referral. There have been studies to show high satisfaction and acceptance levels both among the doctors and the patients. It improves public awareness and improves the health-seeking behavior of the patients, and we can also have post-operative care and follow-up of the patients. To conclude, teleophthalmology serves as a good eye care delivery channel. It provides preventative, curative, and promotive eye care services in a sustainable way. It became a major source of access to healthcare during the COVID-19 pandemic. However, even now in the post-COVID-19 pandemic era, it is here to stay. Thank you.
Thank you, Ankita.
Thank you,
I
sir.
think ophthalmology has become a norm, and this is one good thing that has
Yes, sir.
come out of COVID.
Yes, sir.